Hi, my name is Madison. I'm a student nurse with the University of South Alabama. This is going to be my enema portion of my checkoff. Okay, so first things first is we would walk in our patient's room, introduce ourselves, and we would double check our order and verify our patient. So we have Jaguar Jones, 82563, 82563, rooms 2040, rooms 2040. Okay, so this is our correct patient. Then we would verify the order, soap suds enema on arrival to floor. Okay, so we'd be given a soap suds enema. We would then explain that procedure to our patient, perform hand hygiene, and we would start getting our enema bag ready. So we'd have the enema bag clamped, and then we would insert 750 to 1,000 mLs of warm water. And as you're doing this, you could explain the procedure to the patient, asking if they had any concerns or any questions. Okay, so I'm going to show you. Here is our 500 mark, and right there is our 1,000, so we're a little bit under the 1,000. So you would have it between 750 and 1,000 mLs. Then you would get your Castiel soap, open, and you pour it into your bag. You wouldn't do this before you pour the water in, because that would just create too many suds when you're pouring the water in, and then you would gently rock the bag back and forth to mix the soap in. After doing that, you would then prime your enema tube. Take that tip off. Okay, we have water flow. Okay, sorry, I can't really see it. Tube water flow. Your enema has been primed. You would then reclamp. And I'm going to cap that so I don't get lubrication over everything. And then normally you would hang the bag on an IV pole. Because I don't have an IV pole, we can also lay it on a flat surface, which is not the patient's bed. Then I would perform hand hygiene once more, and this time I would don my clean gloves. I would also be putting the patient into a working position in the bed, and I'd be lowering the side rails, and I would help position the patient into left lying sims or left lateral sims, with their buttocks facing me, and their right leg would be slightly cocked up. Then we would get a waterproof drape. Inserting it below the patient's buttocks. And we would get water-soluble lubricant, open that, and spread a little bit there as well. And we would also have our bedpans on standby at that time. So we would instruct the patient to take deep breaths while we're inserting, and you would also instruct the patient if they have hemorrhoids that they can bear down to help aid the procedure. So you would, normally this cap would be off, but I don't want to get lubrication all over my box. So you would spread the patient's butt cheeks with your non-dominant hand, and then you would begin insertion. You would insert about 3 to 4 inches, and then you would hold that enema in place. You would then unclamp your enema tube, and you would raise the bag 12 to 18 inches. And as then the enema would slowly insert, and as that's happening, if the patient has any gastric discomfort or abdominal pain or cramping, you would lower the bag to slow the procedure or stop, and wait for the discomfort to pass before proceeding with the procedure once more. So after the enema has been fully inserted, you would carefully, gently remove the enema tube, disposing of your enema. And you would instruct the patient to hold for 10 to 15 minutes, and then you would help them get onto a bedpan after that time. For a normal bedpan, the wide portion would be the part that goes underneath their buttocks, while the skinnier part goes towards their knees. And then for a fracture bedpan, or this type of bedpan, the flat part would go underneath their buttocks, with the wider part going underneath their legs or their knees. So before you touched all that, you would clean up your enema area, get rid of the enema, take off your gloves. Well, you could take off your gloves and then don a clean pair for that part. So you would assist the patient onto the bedpan after 10 to 15 minutes of them holding the enema in, and then you would give them some privacy so they can release. And then you would, so I'm going to go take off my gloves. Then you would everything's been cleaned up. Assist the patient with a new pair of clean gloves on. Assist the patient back into a comfortable position after you've removed the bedpan, and if need be, performed care for any secretions. So you've adjusted the patient back in normal position, lowered them back down, and raised the bed rails. Raised 3 out of 4 bed rails. Well, no, they're bedridden with the enema. You see, you'd raise the bed rails, and then we would document the time that the enema was given, the type of enema, the amount for secretions, any what type, amount, color, consistency, and how the patient handled the procedure as well. Was there any grimacing? Did they express any discomfort? Did they verbalize anything? And after documentation, the patient's been placed back into a comfortable procedure. And of course, you've performed your hand hygiene. That would be the conclusion of the enema checkoff.